Hi, everyone. Thank you for hanging on till close to the end. We're thrilled to have you guys with us. Just to introduce ourselves, so I'm Jill Posner.
Megan McCoy.
And we are PEM physicians from Children's Hospital of Philadelphia. So we're all involved in education. We love teaching, but we have been finding it more and more challenging, probably like you guys have, to really find the time to teach on our shifts. Show of hands, faculty? Residents? It's all faculty. Okay. How much teaching? Was that?
I'm a fellow.
Fellow, okay.
Advanced practice provider.
Anybody we missed in terms of role? And you have trainees on your shifts with you. Okay, great. So we have we hope, a really outstanding program where we're going to go through a lot of different activities and have you hopefully walk away with some real pearls of little ways that you can kind of capitalize on making the most out of your clinical shifts for your learners. So you can see our objectives here. We're going to go through a lot of different activities, like we said, but mostly we're going to focus on setting the stage, a bunch of strategies for how you can integrate teaching into your shift, and then in particular, a couple of areas that we feel like will give you kind of a lot of mileage, something called signposting. Familiar with signposting? Some nods this way and some nods this way, so that's great. Okay, so we're gonna, like I said, this is very participatory. So let's just have a shout out. So what are some of your challenges to teaching on shift?
Not enough time.
Should I repeat for the, not enough time?
Yeah, why?
Go ahead, just shout it out. Yeah, not enough time. Tough one.
Like night shift. Tired.
Fatigue, tired, overload. What else?
Teaching like a high quality pearl, or like something that's, also to the level of the learner.
Do you have different learners with you on each shift, or do you have some longitudinal experience?
From like rotator to senior resident.
And you may not know where they are in their own learning curve, right? Okay, a couple more? It's just not a great environment for it, right? Or maybe it is. So that's what we're hoping to walk away with. All right, so lots and lots of things, right? Multiple roles. We have to focus on flow, and we have to focus on the angry patient. And we have to make sure we're taking really good care of our patients and our learners at the same time. So and documentation, and then the really sick patient comes in, and we're all doing something else. So lots and lots of different barriers. Okay, I'm going to pass to Megan now. All right.
So,
There we go. Thank you, Jill.
so one of the things we want to highlight is the key to the start of being successful in teaching is setting the stage with your learners, right? And this is an instance where putting in a little bit of extra time at the beginning of your shift will really pay dividends. So we are gonna spotlight for you in the next 5 minutes some of the ways that you can set your stage for positive teaching session, a positive shift, right? You need to take good patient care. That's number one. But you want your trainees or those you're working with to end the shift feeling like they are learning, they're improving their clinical skills, and you want to have fun, right? We work a lot of hours, there's lots of burnout. You want to leave your shift still feeling jazzed, feeling excited. So we are going to, for the next several minutes, we're going to watch a little clip. And during the clip, there's a few things I want you to pay attention to. So in particular, do you guys all know Jack Black? So we're going to watch some of the things he does in this video that makes him a successful teacher, and then think about ways that we can incorporate that for ourselves.
So just make notes of what you see.
Mr. S., what's going on? Mr. S., what's going on?
I heard you in music class. You guys can really play. Why didn't anyone tell me? You. What's your name?
Zach.
You play the guitar?
Yeah?
Okay, come here. You ever played electric guitar?
My dad won't let me. He thinks it's a waste of time.
A waste of... Try this one. Okay. There's a guitar pick, and you pluck along with me, okay? If you can. Yes. Yes. Okay, you stay right there. Don't move. Piano man, front and center. What's your name?
Lawrence.
Lawrence, you ever played keyboards? Any techno?
No, I only play piano.
Okay, all right, fair enough. Try this out for me, okay? Just give this a try on my count, all right? 1, 2, 3, 4. Yeah. Yes. Come on, now touch me, babe. Ba-da-ba-da, can't you see that I am not afraid? Shaka-ga-ga. Lawrence is good at piano. He shall be rocking in my shoe. Ra-ga-ga-ga. Stop. That's perfect. You're perfect. Stay right there, okay? You, could you come up here, please? What was your name?
Katie.
Katie, what was that thing you were playing today, the big thing?
Cello.
Okay, this is a bass guitar, and it's the exact same thing, but instead of playing like this, you tip it on the side. Cello, you've got a bass. Try it on. Okay, now play this note right here. That's a G. Okay, but let your fingers do the rock and keep that G coming all day long. G, 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 G. Good, stop. Are there any drummers in the house?
I play percussion. That's because he couldn't play anything else. Shut up.
Come here, dude. Just see if you can do what I do, okay? Just give it a try. Okay? Give that a try. Okay! That's really good. Just stay right here. All right, okay. Lawrence, give me a G note. With the fifth above it, and the middle one. No middle one, I changed my mind. Now go an octave below. Now give me some rhythm. Bum, 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 bum. And keep that same rhythm. Go. Okay. Katie, remember that note I taught you, the G? Play. But also keep it rocking good. Bum, bum. Okay, give me like a chunk, chicka, 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 chunk. Good. Okay, no, that's bad. That's like George of the Jungle. Play it up here on the cymbal, but really light. Oh, that's it. Okay, keep going with that, Zach. You remember this thing I taught you a minute ago? It goes like... Yes! Yes! Boom! All right, let's go! Oh! All right, stop. You guys, stop messing around.
That's like basically you guys on shift, right?
So we are not suggesting that we're all quite as charismatic as Jack Black, right? Like, I can't do that. But let's talk about what are some of the things you noticed that do relate to how we're teaching on shift and do relate to what we do. Like, what does Jack Black do to really get everyone jazzed up?
He chose some good songs.
Chose good songs, right? So choose good material.
Well,
What?
he made sure that he gave each student what they were good at or what they knew,
Yeah.
which
Yeah.
I think it goes a long way for someone who is very scared of being ED and feels like everyone's watching them. So
Absolutely. Yeah, so positive, right? Every single person, he's like, good, 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 yeah, 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 yeah. You know, like, talk about lots of positive encouragement. What else? Like,
Definitely the high energy, and I think of it a lot with our outside rotators, especially those who are clearly not interested in PEM, and you have to be the energy to bring them into it. So
yeah,
yeah.
and find a way to get in and maybe connect with what they might feel is interesting about their rotation, right? What if, you know, you may have a psychiatry intern, you have lots of different people in different areas who ultimately are not going to be practicing EM, but what are they interested in about the patients they're going to see that day? What else?
Assessing the skills of the learners, seeing where they're at and building appropriately.
Exactly. That's a great one, assessing the skill of the learners. Someone else had something? Break everything down into really small, manageable pieces. And then thinking about setting the stage, what did he do at the very beginning with each person? Did anyone notice? Yeah, he asked their name, and then for Piano Man, he actually said, like, have you ever played before? Or something like, so where are you from? Like, what program, what year, how long have you been rotating with us? Like, if they're not one of your categorical trainees or someone you work with regularly. So making that time to get to know who you're working with so that they feel like you care about them, and also simultaneously, you may actually care a little bit more about them when you remember their name, when you're like, oh, you grew up in this area, or you're from this program, or you're this year, or you have a new baby, or whatever the situation may be. Anytime we can build that connection, it'll just foster a more positive learning environment and will make anyone feel more comfortable. And when you feel more comfortable, everyone's more likely to get something else out of it. We highlighted really being positive. And then one of the other things he did was being pretty specific. And we're going to talk about both of those things and strategies to incorporate that in your teaching. And then the one other thing I want to highlight about this is we're going to get to this, but talking about signposting, like letting people know I'm going to be teaching today. Like during this shift, our goal is to give great patient care, but throughout the day, I'm going to be giving you little nuggets of teaching. I think you'd mentioned trying to find like a pearl for the advanced learner and finding something that's applicable and saying to people who are maybe not interested in your rotation, like, we're going to find something today that is really applicable to your learning. And using those words, teaching, learning, like, I'm going to do that for you. And then also mentioning, some point during this shift, I might give you feedback. So it doesn't have to be during the shift, but mentioning that word, that will be out there too. So at the end of their shift, they like remember, oh yeah, she did teach me. Like that was teaching. Because sometimes we as the teachers feel like we've been teaching all shift, right? You're like, I told you 75 pearls. And then you like get an evaluation that says like no teaching on shift. And you're like, that's what I was doing. So we need to just call it out a little better as well. Any other thoughts about the video? All right. So wrapping up the setting the stage. So team introduction. So this is really where just taking a few extra minutes at the beginning. We have really encouraged our faculty to do a pre-brief. So we happen to have a format where we round as a team, but even if you don't, at the beginning of your shift, making sure you literally know everyone's name. It's embarrassing to realize I don't know the last name of the person who I'm working with, nor how to introduce them to a family. Doesn't make them feel valued. Get to know a little bit about them. Set expectations, like, what do I want from you? What am I hoping? Like in terms of how quickly you're going to see patients, charting, when to come get me, like how much autonomy I expect. Set the tone, so hopefully keeping it really positive and encouraging. And then be explicit. Like, I want you to learn on this shift as well. Like, that is one of my goals for you, in addition to really taking care of our patients, is also you will end the day, or you will end this rotation feeling like you have learned and you're growing as a trainee and a physician or a practitioner. All right, and I'm going to hand over to Anna.
All right, so you've taken sort of that little bit of extra time for your pre-brief, but then you like look at the track board and there's 35 people in the waiting room and you're like, oh God, like how am I going to get all of this done, take really good care of all of these patients? I have a lot of like actual tasks I have to complete, right? And I have all these people who can help me, but who also like want something from me. They want me to teach them, right? So what we're gonna try to do is help you think through, how do you take the things that you have to do anyway to take care of your patients and sort of sneakily turn those into teaching moments So that, and as Megan said, you've sort of already signposted, we're going to be teaching, right? So you get to say, like, I got to do this thing anyway. You, come with me. We're going to do this together. I got it done, and you'll learn something. And I told you were going to learn something, so you'll remember. Right? So some of the things that you can do that we said you have to do anyway, right? Like, you have to see all the patients if you're the attending, right? If you're the fellow. And for the residents, right? Like, the patients that are assigned to you, you have to see all of them anyway, right? So maybe when you go see them, you bring your trainee, right? Or if you need to examine the patient and you want to be able to observe them doing something so that you can give them feedback, sometimes you can do the thing that you need to do while watching them. So you could say, well, I need to examine the patient anyway, but we need to get consent for this LP. How about, let's go in together. You do the consent. I'm going to listen while I'm examining this child, and I'm going to hear you give a consent. Or I'm going to hear you talk about the procedure that we're going to do with the family. Or I'm going to watch you discuss the workup, right? Or give discharge instructions. I had to be in there anyway. It doesn't take me any extra time. But now I have something that I actually watched you do that I can give you feedback on, right? Because we hate when you finally have cleared that massive waiting room and you're looking at your list of, your inbox of 45 charts, and the resident comes up and they're like, so do you have any feedback for me today on the shift? And you're like, oh my God. Like, I actually didn't watch you do any of these things because we were running around like crazy, right? So if you can think about the ways in which you have to do some of these things anyway, we would encourage you to bring your learners along whenever you can, or follow them, right? Sometimes it's that we say, hey, you come with me, or sometimes you're saying, you know what, you're going in. Since you're going in, we have to write a note anyway. How about I scribe for you? And they love that. They're like, are you kidding? You're going to write the note? And you're like, yeah, how about... I like the note how I write it better than they write it anyway, so it's going to save me time in the long run. So sometimes what I'll do is I'll sit there and I let them introduce me and themselves. That way the patient knows that like they are really the person sort of driving the care. And I say, I'm just going to sit here and take notes on our visit while we're talking. I get to watch them do the whole visit. I get the note how I want it because I wrote it. And then I have all sorts of things that I can give them feedback on, right? So I can give them feedback on their history taking, on their exam skills, on the way that they talk about a plan with the family, right? And I had to see the kid anyway, right? Or in your case, in many cases, the adult, right? I have to see that patient anyway. So now I've seen them, my notes done how I like it, and I've gotten to watch my learner do a bunch of skills that I can now give them feedback on. Yeah. So we're going to talk about a couple of sort of ways to get, while you're watching your learners do these things, you want to give them some feedback, but you don't want to have to give them this like long belabored discussion like Feedback Friday upstairs in the inpatient units. We don't have time for that in the emergency department, right? You have 30 seconds several times over the course of the shift to either reinforce a behavior that you saw that you like or extinguish a behavior that you would like not to continue. So we're going to play a tiny game. So I need 2 people. It's not hard. 1, 2. Yeah. All right. You get a New Orleans themed prize at the end, okay? You're gonna get pralines at the end. All right. What's your name? Fiona. Kim. All right. So Kim, you are gonna be our educator. Okay, Fiona, you're gonna be the learner. So come on up for a second, Kim. So just Kim for a second. Okay. So I have hidden a Sally's Creole praline in this room. And your learner's job is to find it. And she's going to find it with feedback from you. Oh. Okay? And while she's looking for it, the only feedback that you can give her is the word no.
Okay.
Okay?
Are you going to tell me?
I am going to tell you where it is.
Okay. Verbally, can I give any nonverbal cues?
No.
Ooh, trying to work the room.
Work in the system. I like it. All right, go for it.
System.
All right.
The whole room is fair game.
Is it under a chair?
No.
Is it?
Oh, you walk around.
Yeah.
So actually walk around and you can give her feedback on her, what she's actually physically doing.
Am I in the right corner of the room?
No.
Okay. If I'm standing here, is it on the right side of the room?
No.
Oh,
Left side of the
that's a
room?
good question.
Yeah. It has to be one of those.
You can only say no.
Okay.
You can keep walking around and play it like hot and cold too. Like you could walk and she can give you feedback on your direction.
No.
How are you feeling, Fiona?
Pretty lost.
So you're lost. Is it annoying?
Yes.
Yes, it's annoying. Okay. Do you want to tell Fiona where it is?
You're like, I don't have it.
It's
It's right under.
here. It's right under the projector. All right, there you go. All right, so wait, Kim, since you're doing such a good job, I need you to come back up again. I need one more learner. Okay, what's your name? Adam. All right. So now I have hidden another one, and you can only say yes. Okay?
It's very pediatrician kind of game right now, right?
Yeah.
All right, Adam, go for it.
Can I ask questions? Okay. Is it in the back room? Okay. Is it in the front room?
Yes.
Okay.
And you can give him feedback on his actual actions. Where?
I can't?
Yes,
You can.
you can say like,
You
like
can
hot and
no, like
cold,
you can
say
you can do
yes.
like hot and cold, but you can only say yes.
So you can say yes. Is it under here? Okay, clearly not.
Yes, yes.
Oh, hey, look at that.
Awesome. No, that's okay. So he happens to be a very good seeker, right? And there's not that many places to hide here, but the point is pretty clear, right? So if you like our learners can do. Can you get one too? Like our learners can. There's like infinity things that they could be doing wrong, right? So if you just tell them the things that they're doing wrong, A, it's demoralizing, right? Like it doesn't feel good, and you feel lost, and it's frustrating. But B, like you could hear no all day because when you're in a new learning environment, like you do most things wrong, really, right? And so if you, does anyone have a toddler? Okay, so if you can catch them being good, it's the same thing, right? So you say like, yes, I love the words that you used just now when you consented the patient. You said specifically this. That was great. That took 10 seconds. They have a really clear idea of what it was that they did right, and you get to move on with your life, right? And they got some feedback. Awesome. Where's my clicker?
Picture Jack Black going, yes, yes, yes.
Yeah,
Like,
exactly.
and how good the other person feels and how that like links in their mind in a really positive way, and they'll remember it in the future.
Yeah, and like, yes, Adam is very fast because he is very fast, but it is also significantly more efficient, right? Like telling people what they're doing right and catching them being right is much more efficient than giving them the litany of all the things that you wish that they had done differently over the course of your 8 to 10 to 12 hours together, right? Awesome, right? So we talked about this. You're going to be efficient by harnessing positivity, by being a little bit Jack Black, and also just catching the thing that you love that they did. And move on to another feedback tip.
Okay, so we've talked about this sort of a little bit with direct observation feedback. So using the opportunity to observe your learner as a learning opportunity and then giving them feedback on what they did. And there are lots of different times or opportunities for observation, right? So Anna talked about some of them in the beginning, but you could talk about, watch them giving a diagnosis or talking about test results or giving discharge instructions. You can watch them do a physical exam, or you can watch them with a procedure. So lots of different opportunities for observing them. And here, for this activity, we're really focusing on the specificity. So before we were talking about, being very positive, but now we want to talk about, okay, let's give them really specific feedback or specific guidance, because again, that captures not only are they learning to articulate better or provide what the patient needs better, but your patient's getting the information that you want them to get, or the procedure's going to be done in the way that you expect it to be done. Okay, so who's got a clicker? All right, so we have another activity, and we need, guess what? 2 learners. Come on forward. What's your name?
Rob.
Hi, Rob. And we need one more. Super easy. Who likes procedures? Okay, good. Come on forward. We're going to have you do a procedure in front of all your peers here. No, I'm just kidding. What's your name? So we got Robert and Parks. Okay. I have mine. Yes. Okay, so we need you to be blindfolded. We forgot. We forgot that this was a party game with blindfold. Okay, we won't let you hurt yourselves or anyone else for that matter. You actually need to go ahead. Let's have you blindfold now. And then, Parks, I'm going to have you come with me over here. And Robert, you're going to be...
And you're not going to get COVID through your eyeballs now. We're helping them.
That's right.
See? This is your COVID off.
Do you, maybe you want to shift that way just a little bit. Okay, so no cheating, Robert and Parks. Okay, so this is simulating a procedure. So we're going to help our learners here, Parks and Robert, through this procedure. You can listen to that as well. So come on over here, Parks.
What I want you to do is just reach out to the sign. When you touch it, your sticker down. I'm going to give you a little sticker, and then your job is to get it onto the target. Okay? And I'll give you these guys.
So you guys are going to be learning this at the same time. So just, Robert, you listen to Anna's voice and Parks listen to mine. So Parks, have you played Pin the Tail and Donkey before? You have. Okay, how did it go? The last time? Okay. Well, what part of Pin the Tail and Donkey would you like to work on today? Okay, terrific. So look, I'm here with you. If you need anything, you need my help, just kind of raise your left hand, and you know that'll just kind of be the signal that you need some help. Okay? All right. So I'm going to just go ahead and give you the, the sticker here. There you go. Sure. You're actually quite close with your right hand. You're very close. Go ahead. Why don't you take a try, and I can guide you. That's not bad. Go ahead. Why don't you go ahead and place that? I'll give you another one. And with the next one, just go a little bit more to the left and a little bit further down. Yeah, try that one. Go ahead. Okay, great. So I liked how you went left and down, but actually with this one, try to go right in between where you went before. So here's another one. I can kind of guide you a little bit there. Yeah. Okay, you are so close. You're so close. Keep going. This is the last one. I think you're gonna get it this time. You're really close. I think you got this. Just go right there, right between your three fingers there. You're like amazingly close. Perfect. Keep going. Yeah, that's great. All right. Okay, you're done. You're both done. All right. So, Parks, how do you think that went?
Pretty well.
Yeah, I think so too. I think so too. You know, I noticed a few things. If I could share some of that with you. I noticed that you were using your opposite hand to remember where you had gone before. And I haven't seen that done before with this particular procedure, but I really like that. And in fact, I might even start using that for myself. I also noticed that you were asking me a lot of questions. And I think that was really instructive, not only for you, but it also helped me know what you were thinking so that I could better guide you during this procedure. And I noticed you felt pretty good about it at the end, and I think you should feel good. Congratulations. And now you can enter it in your procedure log. So is there anything we talked about? I'm not finished. Is there anything that we talked about that didn't make sense to you, or anything you want me to clarify?
How would I know without your guidance where to go?
That's a good question. So next time you could probably lift the mask up a little bit, maybe do it with one eye open and one eye closed. And the time after that, we'll actually unblindfold you. So for the next time, let's work on that one eye open. that sound good? Okay, great. Thank you both.
How did it go?
I felt completely lost.
Yeah, you were. And did I give you any useful feedback?
No.
Nice. You were like wrong.
Yeah, you were like wrong. I was like, okay, I'll try the other side. And you're like, yeah. And then try again. And you're like, no, wrong again. I'm like, oh, okay. So now I don't know. It's kind of like,
And then I got frustrated with you.
yeah,
And so what'd I do?
just took over.
Have you guys ever had an attending do that? Oh, sorry, you didn't get the tube this time. Hang on, I'll just do it. And then, like, just keep practicing, right? Like, that's super unhelpful. You don't even know what to practice, right? And what was the debrief that I gave you?
Just keep practicing.
Just keep practicing. You guys ever gotten feedback about that? Just keep practicing, read more, right? You're like, what amount of reading is going to make that better? Like nothing, right? You needed really specific guidance because you hadn't done it before, right? And even if you had, right, you want to be able to give someone, say you're looking at the CMAC and you want to be able to give them really specific real-time feedback about what it is that you're seeing, right? Like just know you're not in the chords is not helpful. Like, yeah, no, they know that, right? Like, how do I get there is the question, right? So again, it's about the positivity piece, but also being super specific, and it ends up helping you in the long run, right? Like if you take the time to be a little bit more specific, then you actually get what you need better, right? Like you took way better care of that patient, right? The tube is in on that patient. Here you're like, gosh, I hope like maybe we needed to call anesthesia, right? Or the attending just did it, right? And if I had let you go, right, you would have been meandering around forever. So it's actually much more efficient to just be very, very clear with what you want. Awesome.
Okay, so this idea of direct observation with feedback, it also does take a little bit of deliberance. Like you do want to think about it ahead of time, right? So you want to prep your learner, what your expectations are going to be, and also yourself, right? It is kind of, we know that we can do these things faster ourselves and probably better ourselves. When you're going to be with the family or with the patient, let the learner introduce you, right? Because that already, when you walk in and say, hi, I'm Dr. Posner, I'm the attending physician today, this is Parks, he's the resident, it already kind of has the patient or their family looking at you. They know who's in charge, but if you flip that the other way, let the resident introduce you, and then stand out of the way. Now, a procedure might be a little bit different, but let's say the process of getting consent. Let the line of vision be between the patient and the learner so that you're not interfering with that. There's lots of things you can watch, as you guys know. You can watch their verbiage, you can watch their body language, you can watch how the patient is responding. Decide if interrupting is necessary. Most of the time, we actually don't need to interrupt. We feel like we want to, right? Because there's this sort of dilemma, right? You know that the patient's got to get the right material, they got to get the right information, but this resident needs to learn. And if they're using a lot of jargon or there's something not going exactly the way you would do it, consider not interrupting, because it will be a good learning experience if the patient says, I don't know what you just said, right? So they'll get the immediate feedback from the patient rather than from you. If they're giving wrong information, you need to interrupt. But there's a way you can do that doesn't feel shaming to the resident, that doesn't feel embarrassing. And first of all, that's actually asking for permission, right? So if you say to the resident, actually, do you mind if I interrupt here for a moment? Or do you mind if I add something? Again, it's just respectful. Like you respect what they're saying, even if it's wrong, and you want to correct it. And then make it something sort of positive, right? You're adding something. You're not saying, well, actually, let me correct what he was saying. You're adding, and it's going to be obvious maybe that the other thing was wrong and you're subtracting, but you're not really putting it out there as like, I'm taking away what they did. I'm really adding to what they said. And then bring it back to them. Don't continue to take over. If the patient now starts looking at you, all you need to do is use a little bit of body language and physically turn it back, and they'll do the same thing. They'll turn it back. Or say, you know what, Parks, do you want to address that question that they just asked? And turn it back to them. And it saves them, it makes a good learning experience. The debriefing outside the room, so I use the adapt. There's lots of different mnemonics, but I used adapt, so that's ask. How do you think that went? Let them do a little self-reflection. Discuss. What did you observe? Don't focus on personality traits, right? They can't fix those. Focus on behaviors that you saw, that you observed, those reinforcing. This is what I thought you did really well. And then some corrective. Here's where I think you could improve. The next A is for ask again. So making sure they actually heard you. So is there anything that I said that didn't make sense? Do you have any questions about any of the things we discussed? And then PT, ADA, PT, is plan together. So the next time we do this, or the next time you do this, what would you do differently? If you had to intervene, just explain why, and here's why I intervened. But if you did it in this respectful way, it again will become a learning experience, not a demoralizing one. Any questions?
One of the things to highlight about all of this that Jill is saying in terms of the debrief and things is that can literally happen as you leave the room and walk to wherever you're going to next, as you leave the resuscitation bay, on the way, like, it doesn't have to be a formal, like, we're gonna sit down. It's literally, hey, let's talk while we walk, is that okay? And so you're, literally a minute more, a minute, 30 seconds. So it doesn't have to be a big formal thing. And that also can take away some of the response that someone has when they think they're about to get feed, like you're sitting down across from you, okay, let's sit down and talk. Like automatically you're like, oh gosh, this is where I hear like everything I did wrong, right? But it makes it seem more casual, more psychologically safe for the learner. So we're going to go back to one of the things I mentioned at the beginning, which is signposting, right? And that's really letting the people you're working with, your trainees or the other providers you're trying to teach, know what you are doing. So letting them know that you are teaching. Like, it seems so silly, but explicitly calling it out. Hey, do you want me to teach you a little bit about the PCARN rules for head trauma? Hey, what do you know about diabetes? Okay, I'm going to teach you about fluid replacement or insulin or XYZ. And so that they really get like, oh, this is teaching. Because as silly as it seems, a lot of times people aren't recognizing it for what it is because we're so used to like teaching is I'm sitting here in a lecture hall with someone in front of me or someone is handing me something to read and learn about. So really calling out in those little moments, this is teaching. And then similarly with feedback, calling out like I'm going to give you some of my reflections or my observations on what you have been doing and what I've been witnessing. So, and these are just some of the examples of things you can do, the phraseology that might have. And I think one of the big things with feedback is actually asking for permission. So, is this a good time for me to give you some feedback? Do you mind if I give you a little feedback about how that conversation with the consultant went, with the parent went? Using those explicit words that I'm going to give you feedback or tell you what I noticed in that, but also making sure it's an okay time. If whoever you're working with is really stressed or is going through in their head the to-do list of the next 7 items they need to do, they may not hear anything you're saying anyway, and then it's best to just save it for later. So I think really just highlighting so people you're working with recognize what you are doing and see that throughout the day they are getting both feedback and teaching. And maybe just stressing a little, feedback's different than evaluation, right? Like, so you may evaluate them at the end, but feedback during the day is really what learners are looking for. Like, how am I doing? What can I do better? Not necessarily a summative, am I going to get an A through an F on my rotation or my experience here? I think, so we are 3 minutes ahead of schedule, but that seems great for us. We hope that everyone sort of takes home, if you can just pick several things, take a little bit of time at the beginning of your working day or your working relationship to set the stage. Get to know people and set expectations. The one thing we know from all our learners, and that's anyone from APPs who are, work with us all the time, to rotating residents, to our own residents, is everyone says, I want to know what the person who's quote unquote in charge of me for that shift wants from me. Like, I want to know how I can do a good job. And it is different for everyone. All 3 of us have similar but different expectations of people we work with. And people want to know that. Make what you're doing count twice. There's always a way to there's often, I shouldn't say always, a way to bring someone in and make whatever you were going to be doing anyway a learning experience or part of teaching with who you're working with. And then remember to signpost all that you're doing. Get credit for what you are doing so people understand like that is what it is, because there's nothing more frustrating than feeling like you have taught all day and then people thinking that they like haven't, or not recognizing, oh, when I brought you in to look at that ear and said that is an otitis, like that was teaching. You just like saw something new. But we have like 5 extra minutes maybe if anyone. We had some scenarios we can talk about that we can just go through if anyone has questions or things they've encountered in the clinical learning environment that they struggle with learners.
So one thing that I've noticed that I personally struggle with when I'm helping with learners is like when we're doing like a hands-on procedure or something, and I'm trying to give them like advice on how to, I don't know, manipulate like the sutures to do a suture or something. And then when I explain it, they don't quite get it. So then I'm like, I'm trying to resist the urge to kind of like go in and just be like, no, this is what I was trying to say. Like, what are some ways to kind of frame your mindset to try and get out of that emotion?
To get out of the motion, like the impetus to intervene?
Yeah.
That's hard. I mean, I think one of the things is, so even for procedural teaching, I myself am a big fan of a little just-in-time refresher before I even go in the room. So we talk about that a lot for LPs, for intubations, even for an IND. But for something like sutures, actually like making sure I understand how much the person is actually sutured. I think we've all had tons of times where you're like, are you comfortable suturing? Absolutely. And you walk in the middle and I'm like, we may define comfort differently. Because you are comfortable, and comfort is different than competent, right? So you're very comfortable and we're gonna have to take out those stitches. So I think, again, a few minutes ahead of time, just saying like, oh, have you sutured a child, or have you done a face, or have you done something complex? One of the things I like to do, most of us don't have like suture models readily available where we can be like, show me your skills. But then I think as the teacher, actually like talking to yourself and being like, okay, I'm gonna like just keep calm as long as they're not hurting the patient or doing any damage, like giving them, like just trying to be patient and giving them a few minutes to work it through. Sometimes, I mean, you can literally say, do you mind if I like physically help you? Like put my hand on your hand on the needle driver, or do you mind if I put my hand over the LP needle so you can feel, or pull it out a bit? And I think that's very helpful.
I would say I do that a lot. I ask for permission, and then
Yeah.
I say, do you mind if I touch your hand and re-angle your hand? And then like, it's like, no, I want you to go in at 90 degrees. That means I want you to go like this, and then go like that, right? And I just ask for permission to do that. And my personal mantra is that I, like to get myself in the headspace that you're talking about, is I just have to remember that I do not know how to drive anywhere where like I haven't driven there myself. Like if someone has always given me the directions or I used Weiss, I don't know how to get there. Unless I turned off the map and did it myself, I don't understand how to get to those places, right? So that's just how I think about it. I remind myself, like, I don't want this person to be reliant on Weiss forever. I want them to actually have a map in their head of this neighborhood, right? And so I gotta just let them do it. I think there are times when you're like, no, these stitches suck and like, you can't let this person leave the hospital like that. Like, that's different, right? But in times where you think you have a little bit of time, I think sometimes just saying like, can I just, it's still their hand.
You can break it down into pieces, right? So maybe they can't do the entire suturing, right? But when you walk in there, it's pretty obvious. So maybe you say, do you mind if I show you how I take the bites, and then you can take over and tie counts. So they still feel like they've participated, they're still learning, but you haven't jumped in and taken over. But the key part, which is where you're going to take the bites, is being done correctly. And they're watching you, so they can do the next time. We do that a lot, airway
all great
If you
suggestions.
ever have the, if you're in the practice of asking people at the beginning of shift, like anything you're hoping to see, anything you're working on, one of the things I think many of us will say is, so I can't promise you're going to get to suture today, or I can't promise you're going to get to see an asthmatic and extremis, but what I can promise is I will make sure I find something today that is really applicable to your learning, your interest. So I know your goal is X, but I will also be mindful that you are a family medicine resident who's about to be practicing independently in 2 months, and I will make sure I tell you 2 things today. Really think about, okay, what will be helpful in your practice? So when you're as a fellow and you're trying to learn yourself, but thinking about, okay, these are the people I'm working with. I know what my pediatric residents might be interested in. I know my EM residents, are very procedurally strong or very good at acute care. They may not have seen molluscum, right? Great, I'm gonna, even though that's not their patient, I'm gonna be like, hey, this is a picture of molluscum, or go look in room 5. That patient, go listen to that baby in 7, and come tell me what you see. So just finding something for every person, but acknowledging at the beginning, it may not be what you were hoping to learn, but still, I'm thinking about you as a learner, and I will try to find something that is of value to you.
Just one thing I add, I definitely had those shifts where I set a goal and I'm excited to do it.
Oh, yeah.
And then for example, I had a resident who was like, I want to do some ultrasound guided PIVs, and I'm like, yeah, let's do it. And then the chaos took over, and we had codes and level 1 traumas and stuff, and never had the time to sit down and do it. And I added we get an eval at the end, and I just put a link to a really good article through IMRA about top 5 things to learn. I'm wrote an eval hey, I'm sorry we didn't get to do this, but I found this resource, and I was kind of bummed at the end because I felt like she just wanted to do that one little thing and I didn't make it happen. But then when I got the eval back from her, she loved that I just added that simple resource. So even if the shift gets away from you, you can do something to get back to their goal or give them something towards it.
And I think just remembering that the bar is quite low in terms of providing psychological safety for people, right? People's expectations are very low. If you remember what they wanted to learn and you write that in their evaluation for them, they're gonna be so grateful. It's quite disappointing in general to me how low the bar is, right? But in general, if you can provide that really personalized little tidbit and you show that you took the time to do that, right? That's really meaningful to people.
We probably need to wrap up, just to stick with our time. Anybody want to share one thing they learned today or one take-home point?
Signposting.
Yeah, I think I forget about, because I've heard some of this stuff before, so I've got the term signposting. The importance of it was highlighting, hey, I'm giving you feedback, or hey, is it a good time to talk about feedback? And I think asking permission is something that I don't always think about necessarily, so especially
Cool.
I think remembering to be really positive. Watching that Jack Black video, I'm man, I want to be the EM version of that.
Yeah, right?
Yeah. Send us a video of you going into just tubes.
Exactly.
But I think it is true. Any uplifting, positive energy. When you go into the night shift, there's 50 people in the waiting room, and you're oh, no one's really excited to be here. Just being guys, we got this. This night is gonna go fast. Because you can guarantee it will go fast, right? You never are. And you are not gonna be tired.
Yeah. Exactly.
All right, so did you notice that a little meta, right? What did you learn today? So when you walk around, damn, I really learned in that. Thank you guys.
Thank you so much for taking part. We do have a little, just a teaching or tip sheet about some of the things we're talking about. It has the ADAPT framework that Jill mentioned and some best practices for teaching efficiently. And if you use the QR code, then you'll have it. Thank you guys so much for playing.